At Moffitt Cancer Center, we conducted a retrospective study looking at the drug interactions of Belumosudil in combination with our immunosuppressive agents, Sirolimus. During the period of time, we were able to evaluate 30 patients who received Belumosudil for treatment of chronic GvHD. And very similar to those pivotal trials, majority of our patients initiated this therapy for moderate to severe chronic GvHD. And in those initial pivotal trials, there wasn't any discussion as far as drug interactions, particularly with the additional immunosuppression. And during those initial phase 1 clinical trials for drug interactions, Belumosudil does have some 3A4 inhibition, and so was initially tested with inducers and inhibitors of 3A4. Belumosudil also has some pH-dependent solubility impact, so they were testing it with a PPI. They did 2 different types of PPIs, and certainly it did show some interactions with those agents. So at our institution, we were really interested to kind of see, and initially we kind of saw in patients some kind of interaction going on. So we wanted to investigate further. So with these 30 patients we included, half of them received PPI prophylaxis, and 8 of them actually received concurrent Tacrolimus, Sirolimus, and Belumosudil. So definitely a pharmacist unique situation. And uniquely, what we saw, our primary objective was to determine the change in concentration over dose ratios upon initiation of Belumosudil with a patient's immunosuppressive therapy. And so we picked this overall outcome because of kind of the interpatient variability we see with TAC concentrations. And certainly we wanted to get an idea if this is a true drug interaction. So what we found is that upon initiation of Belumosudil, we saw a significant change in the concentration over dose ratios at baseline and over 3 additional immunosuppressive dose levels. And this occurred both for Sirolimus as well as Tacrolimus. And so one of the unique aspects that we noticed is that patients receiving Sirolimus required up to a 38% reduction in their Sirolimus dose when given with Belumosudil. In comparison, Tacrolimus was not as drastic, but resulted in a 25% reduction, and these are mean reductions for these patients. I think one of the things for pharmacists, our goal is to make sure that patients are within therapeutic range for their immunosuppressive, due to the fact we don't want to risk GvHD or infection or other complications resulting from high levels. Particularly for patients with Sirolimus, at baseline when we started the drug, 75% of patients were within therapeutic range. However, after the first level was drawn, over 50% of patients were super therapeutic, and we've actually had several patients level greater than 15. And unfortunately, despite several dose modifications, they still remained up to 25% super therapeutic at that dose level 3, so about 74 days before initiation in that 3rd level. Tacrolimus wasn't as robust, but still had an interaction. Again, 75% of patients were therapeutic at initiation, with 25% being subtherapeutic. But at that first dose levels, again, 75% were still therapeutic, but we actually had 25% that were super therapeutic. So again, kind of a change in that as well in time within therapeutic window. One of the other unique things from a pharmacist is we were able to actually capture this drug interaction over time, and that we actually had 9 patients receiving Sirolimus with Belumosudil, and an additional 4 patients receiving Tacrolimus. And we were actually able to see the changes in concentration over dose period, not only within our study period, but also 2 additional levels after stopping the drug. And in both cases, the concentration over dose ratio returned to normal. So this is certainly a drug interaction of note. And in our current practice, we actually recommend an empiric 25% reduction of Tacrolimus and Sirolimus when patients are actually initiated on this drug. So it's very interesting data and very impactful for pharmacists managing immunosuppressive therapy.